Louisiana State Senator who sponsored this bill, Thomas Presley. Sir, thank you for taking the time to be with us. And first off, I am so sorry for what happened to your sister. I know you've widely discussed this. Her then husband was sentenced to prison time this year for spiking her drinks back in 2022 with abortion pill medication to try to terminate her pregnancy. It's horrific. I think anyone familiar with the details of it knows that. I do, though, want to talk to you about what's in this bill that you did not initially include in it for the purpose of prosecuting situations like the one that your sister was in, that is going to make mifepristone and misoprostol Schedule 4 drugs, which was ultimately tacked on. Why vote for that additional piece?
Yeah, thank you so much for having me on. As you mentioned, my sister was the victim of a horrible domestic violence attack where her then husband tried to grind up misoprostol 7 different times and put it into her drinks, trying to kill my now 22-month-old niece and significantly harm my sister and her health. Look, this bill is intended to ensure that doctors, nurse practitioners, and physician's assistants have the opportunity to write these medications, and they will be dispensed at pharmacies throughout the state of Louisiana. That's going to continue when it's for a legitimate healthcare reason. As you mentioned, Louisiana has already outlawed abortion. So we're just trying to put some guardrails in place so that bad actors do not get these medications and use them in harmful ways like that my brother-in-law tried to do with my sister.
So why add on, though, that Schedule 4 designation, which you did not initially have in the bill?
That's right. It was a work in progress through the legislative process. We added that in a House committee. And we did so because, with the crime side, there's a back end and a punishment side. And I felt like by adding these 2 drugs to the Schedule 4 list, that we would have an additional deterrent and less availability for these to be in the hands of bad actors, while still allowing our medical providers to provide the medicine to patients that are in need of the medications. It's a very common occurrence for scheduled drugs to be prescribed by doctors, by nurse practitioners, by physician's assistants, and dispensed at pharmacies throughout Louisiana, and that happens daily.
So as I mentioned, there are additional hurdles making it a Schedule 4 drug. And the medications in particular that we're talking about here, they aren't used just for abortion. They're used for a number of other purposes when it comes to the health of women. So I want to run through some common medical scenarios with you that I'm sure female patients may have some concerns about. Can you unequivocally say that misoprostol will be readily available and as quickly as before when a woman needs it to soften her cervix for the very painful process of IUD insertion?
I can absolutely tell you that in talking to OBGYNs and talking to emergency room physicians and talking to other doctors and other healthcare providers, they will continue to be able to prescribe the medications just as they can other scheduled drugs.
Well, that's not my question. My question is they'll be able to prescribe it. This will add other potential hurdles. There's some storage issues, obviously, when you're talking about a Schedule 4 drug. Will there be any slowing of the process to get these drugs to where they need to be at the time they need to be there?
Based on my conversations with doctors and the hospitals as well as our pharmacies, I feel very confident that this will continue to be able to be prescribed timely and as necessary by physicians and other healthcare providers that have prescribing abilities, and as they can with other medications that are in our scheduled list.
Have you taken into consideration that the law could actually have the effect of doctors instead using no cervical ripening medication in the process of inserting an IUD, which is incredibly painful? Have you protected against that?
Absolutely. Doctors are going to continue to be able to prescribe this medication. We have laws in Louisiana that state specifically and explicitly that doctors are allowed to prescribe these medications for legitimate healthcare purposes outside of elective abortion, which is already illegal in Louisiana. This doesn't change that. We're simply putting the medications into the schedule, which will continue to be able to be allowed to be prescribed. We're really going after the criminal aspect of this, and folks that do not have a doctor-patient relationship, do not have a nurse practitioner or a physician assistant, but rather we have the bad actors that are going out and trying to criminalize these drugs and use them for the weaponization of terminating babies and of trying to harm women, like my sister was harmed and my niece was attempted to be killed by my ex-brother-in-law without my sister's knowledge.
Can I ask you, Schedule 4 means that these drugs would be classified as dangerous, right? That's a key part of what the labeling here means.
Well, they're classified
on.
as controlled. It's a controlled substance, so it's a controlled drug, just like Ambien, just like Tramadol, just like many of our ADD and HDAD or ADD medications as well.
Yeah. ADHD, I think is what you were looking for, yes. But this part of it is that this is a drug that could be dangerous or misused, obviously, is the point of it being a Schedule 4. You also have other drugs, for instance, penicillin, that is 4 times, the risk of death, for instance, 4 times higher than mifepristone. Viagra, which I think you could argue there may be some kind of side market for, 10 times higher. Should they be Schedule 4?
Respectfully, I think that my sister's situation shows that these drugs in particular are used against women, against their will. And I'm very concerned about ensuring that, again, we are maintaining the doctor-patient relationship while continuing to ensure that they are able to get the drugs for legitimate healthcare purposes. And that's exactly what we did by prescribing these drugs into the schedule.
It also seems like there's an effort to look at and try to prevent there being some kind of black market for this. Or I would also posit an example of someone bringing this in. It could even be an acquaintance or a friend or a family member of someone who is seeking an abortion in Louisiana, which obviously is illegal. But someone like that bringing something in for someone to do something that is illegal, and the pregnant woman would not be prosecuted, but anyone bringing it in would also be. I mean, this isn't just about prosecuting people like your former brother-in-law who did a horrible, unimaginable thing. It's also could be used in those instances I just described, right?
Look, respectfully, abortion, again, is illegal already in Louisiana. We're trying to make sure that folks are not.
Yeah, but so then why make it a Schedule 4 then?
What? Because we want to make sure that physicians and nurse practitioners and physicians assistants have the opportunity to prescribe the medication. We need to make sure that these medications are used, and there's no doubt. But even in states where abortion is not illegal, you have a 10-week period where it's not supposed to be written without seeing a doctor at all after 10 weeks of gestation. And we've got to make sure that women are being cared for, or being and checked for ectopic pregnancies when they are being used as well. And I think that's important that we, again, make sure that we're maintaining the doctor-patient relationship rather than having a friend or someone bring medication into a state. That is concerning in and of itself, and quite honestly, it was illegal prior to this legislation passing and hopefully being signed into law shortly. A prescription medication requires a prescription by a doctor, a nurse practitioner, or a physician assistant.
Yeah, all laws that were already in place, right? And the Schedule 4 is not something you initially had in there. But let me ask you this. You talk about the importance of caring for women. Your state is 46th out of 50 for maternal expectancy. So when you're talking about there being better care for women, I mean, why aren't you tackling that instead?
We are continuing to do as much as we can on pushing maternal health care into the forefront and make sure that we're doing everything possible to, within our budgetary means, to ensure babies are being born. But let's be clear.
I'm talking about mothers, sir.
And mothers as well. And let's be clear here. My sister was a victim of a domestic violence that left her bleeding without any knowledge of why she was bleeding, other than she had had a drink. That's scary and certainly doesn't lead to a high maternal outcome either. And I want to make sure that we are protecting these drugs, again, not get in the way of the physician-patient relationship, but ensure that these are not being sold on the black market and that bad actors